everyone. Thank you for joining our webinar today. My name is Sibel Tasti, and I am part of the recruitment team at InUni, a sister company of Global University System. Today, we are very excited to welcome one of our premium university, Canterbury Christchurch University, located in beautiful Kent, just 1 hour drive from London and 20 minutes from the seaside and beautiful beaches. Today, we will be discussing the different courses opportunity to start your education in the UK and at CCCU and discover public health and mental health well-being courses. I am joined by my colleague at Canterbury Christchurch University, Mr. Murray Allen, who is a senior lecturer and a course director for public health suite of course, so all the public health courses, and Mr. Richard Venner, who is the International Business Development Manager at Canterbury Christchurch University. In the background, I have also my colleague from our marketing team, Sukanya and Jinx, that will be helping us throughout the webinar. Before we start, some housekeeping rules. So you are all in mute. For any question, please use the Q&A box rather than the chat box, and we will be happy to answer all your questions at the end of the presentation. So for now, I leave the floor to Mr. Murray Allen.
Hello, everybody. Good afternoon. As will introduce me, my name is Murray Allen. I'm the course director for the undergrad suite of courses, but I'll also be presenting today on behalf of the postgraduate master's degree courses. So I'm going to start off the presentation just talking about the undergrad courses. So for September 2025, we're going to be running 2 undergraduate courses. They are the Bachelor of Science Honours degree in Public Health and a root course, a related course, the Bachelor of Science Honours degree in Mental Health and Wellbeing. So there are a number of similarities between those, but they are distinct degree pathways. And I'll come through the differences and similarities as we go through the presentation. So, first point, fair question, why study one of these courses? So basically, the academic team that teaches across both the undergraduate and the postgraduate courses here, we've got a very wide range of experience, and a lot of us come from specific public health backgrounds. There's also a number of us that have research backgrounds. We've always been proud of our approachability and being student focused. We're a very inclusive university, very caring, and put our students at the center of the learning. Basically, as a way of going through this course, we're very much focusing on producing graduates that are going to strengthen the public health wider workforce, and that would apply both within the UK and globally. So we've scored very highly in employment surveys in the last years. So a very high proportion of our students end up in relevant employment shortly after graduating. So there's a very strong employment focus within our undergraduate degree courses. So I'm just going to bring up a little slide now that just gives a few headshots of the members of our academic team. I won't go through the individuals, but around that board that you can see there, there's a range of us that teach across both Masters and Bachelor of Science undergraduate courses. Included in there, we do have Professor Julie Balance, who's a faculty lead in research and a specialist in global public health systems. She also teaches within the courses as well, but is kind of helping us really advance our research portfolio just throughout the university, but also through a national basis. So looking at the modules that we study within the undergraduate courses, this is just to give you a bit of an idea of what you would like to study if you came to Christchurch to do our undergraduate courses. So we've got a number of modules that, whether it's the mental health and wellbeing course or the public health course, we've got a number of first year modules that are very much geared to give a grounding in the wider public health understanding. So they include a really interesting course at the beginning of introducing academic skills for health, which is very much like a success module. It's teaching students new to university how to adjust writing academically using things like academic referencing procedures. And basically, it's a fundamental building block for all the other courses. Beyond that, more specific public health and mental health related courses, we look at how people communicate with both health professionals, fellow health professionals, and clients, service users. That's the communication digital health. We also look at a module called contemporary health and lifestyle issues. So what we are very aware of, both through the mental health area and through physical aspects in public health, we know that our lifestyles and our behaviours have a huge impact on our health. So we look at some of the health behaviours, how that incorporates and links in with wider health outcomes. We also look at collaborative working in health. So really throughout the whole public health workforce, there's almost an expectation that at graduate level on employment later on, you'll be working as part of teams and working alongside people with different disciplines, different backgrounds. That's a really sort of clear pathway through careers in the wider public health workforce. So being able to collaborate effectively, both with health professionals and clients or service users is really, really important. And that's why we focus on that right at the beginning of the module in the collaborative working in health module course. So there's some slight variations with the two routes. We've now standardized the environment and green health module, which actually runs across both the mental health and the public health course now. The big issue there is that in 2025, we're increasingly aware of how the environment affects us in many, many different ways, but it particularly affects our health. And that's often an underestimated element of how we live and age healthily. So the impact of the humans on the environment and also the environment on human health is studied on that course. The public health students then look at some of the sociological backgrounds around health and well-being. There's some theories around that that are also shared with the mental health and well-being module, which is mental health, culture and society. So there's a slight variation depending on which route you were looking at taking. The first year course is largely similar, but with one particular module that's quite different. So that's a pattern that happens through the second and third years as well. So if I move on to the modules within the second year, again, we've got some of these core modules. The idea of health promotion or promoting good health is fundamental throughout the whole public health wider workforce. So again, whether people were expected to work in specific mental health and well-being careers or through the many, many public health careers that I'll come to later on, the idea of being able to promote good health to the public, to communities and individuals is really pivotal. So that's one of the key modules in year 2. We also look at developing collaborative practice. Again, that builds on some of the learning from the first year, where we look at, again, how so many areas within health are multidisciplinary or interdisciplinary, and people are often working alongside many other agencies, many other service users and commissioners and stakeholders. So that's a really pivotal part of the learning in the second year. And then we come to health inequalities across the life course. This particular module addresses the idea that is really critical around public health and mental health, that depending on people's backgrounds, depending on things like their level of income, things like their ethnicity, their gender, many other demographic areas, they face certain inequalities. So not everybody, despite what the government might say about there's equal access to everybody for healthcare, actually in practice we know that certain disadvantaged communities have much worse health outcomes because of reduced access, reduced things like health literacy, the understanding around health. So that's one of the really critical points that runs through both the undergraduate and postgraduate courses. So yeah, there's a specific module around health inequalities in the second year. And we also study the evidence-based research. So in the third year, there is a dissertation, which I'll come to shortly, but we look at how we start preparing for that in the second year. We look at how research is collected so that when we are doing our own research for assessments and assignments, we know a little bit more about how various studies are conducted, how that evidence actually ends up being published, and how that influences our practice. So as with all areas of health, the bulk of public health practice should be based on the evidence of what has been shown to be beneficial and effective. So that's a key theme within the evidence-based research module. So those 4 modules are across both courses. Again, there's a slight variation then between the public health and the mental health and wellbeing courses in the second year. So within public health, we also study health protection, which is looking very much at how things like outbreaks happen. Obviously, in recent years, we've seen the impact of COVID on society, but across the world, across the globe, there are many other significant diseases, contagious diseases, that we study how they spread, how they can be contained, and that's one of the elements around health protection, literally as it suggests, how we protect people's health from communicable diseases. And then we also have a module called Health Behaviour Science, which includes aspects of psychology and sociology. So we look at the psychology around why people behave in certain ways in terms of their health. For example, why people eat a certain way or certain foods, why people may use substances, illegal drugs, nicotine, alcohol, and so on. And we look at trying to understand the behavior around that, and also the role of some of those behaviors in society from a sociological point of view. The point being, from a public health practice, is if you understand why people behave in certain ways, then you can actually create health promotion interventions based on that science. The mental health wellbeing group, they cover a couple of slightly different modules. So something that's a really big employment area and a growth area in the UK has been the role of social prescribing. Particularly around benefiting people's mental health as well as their social health. So the idea of social prescribing is that rather than doctors reaching for their prescription pad to give medication, they can actually prescribe things like physical activity programs, art therapy, nature-based programs, things where people actually not taking medical courses, but actually benefiting from just improving their lifestyle and gaining social interactions with other people. There's a lot of research, and it's a growing field here that's actually really beneficial and often more beneficial than doctors prescribing things like antidepressants. So it's a very key area, particularly around mental health. And there's also a module which looks at body, mind, and science. And this is picking up a little bit with some of the themes around psychology and also some of the themes around why people do what they do. Again, it's the concept, if we understand a little bit about how the body and the mind interacts. This is not sort of a new Western philosophy at all. This has been something that's been understood for thousands of years in many cultures, but it's becoming more pertinent now that to keep a healthy body helps to keep a healthy mind. So that's the second year modules. Moving into the final year. All courses have a dissertation. A dissertation is a double module. So whether you're mental health or public health, you would choose an area of your own interests. So we guide people, we supervise people during that course, but whatever your personal area, so by the third year, people have often got very specific areas of interest they've developed over the first couple of years. And the dissertation is either a literature-based review or an empirical research study where you can look at go into much more depth about a particular area of interest. And you get free rein to choose this, as long as obviously it's related to the public health or the mental health course. It's a large piece of independent work, but with guidance from supervisors that are assigned to help you throughout your final year. There's also a course on health and lifestyle epidemiology. So epidemiology is really looking at the study of diseases, how they spread, but also the prevalence, looking at surveillance. So a lot of the data we hear about how many people have certain conditions, how certain diseases spread, how our lifestyle impacts on our health, that comes from the field of epidemiology. And this is very much pertinent to both the general public health field, but also more specifically mental health. So that's a core module across the two. And we also have a working in health module where there's a chance to get, you don't actually spend time in a placement as such, but you learn about how health impacts on the workforce. So obviously, whichever area in the world you're working at, the majority of people, once they finish their degrees, end up having to get a job. And we spend a lot of our time in our lives working, and that has a big impact on our health. And as a result, the workforce and the workplace again has a big influence on both our physical and mental health. So that's something that's explored in the working in health module. The differences between the public health and the mental health courses at that stage in the final year: the two standalone modules for public health, we look at public policy and strategies. So we look at some of the policies that outline the key areas around public health, such as UK drug policies, alcohol policies, guidance on nutrition, physical activity, and so on. And there's also an opportunity to study global public health. Again, this builds a little bit on some of the work from health protection in the second year, and looks at some of the areas, rather than focusing on the UK, looks at much wider areas. So some of the impacts on the learning that built up in the first 2 years around inequalities in health, for example, and health protection, we look at how that happens across the globe. So it's sort of starting to move away from just the UK-based work, and that's a really useful bridging course also for some of our undergraduate students that choose to stay with us and go on to the master's degree in global public health. Meanwhile, the mental health and wellbeing courses, they're slightly different in those two modules in the final year. There's one that looks at critical discourse and representations of mental health. So this is an opportunity to critique and study how the current mental health field is perceived across society. And slightly different to that is the aspects of mental health promotion course. So promoting good mental health is a fundamental part of all health. You cannot have good health without good mental health. So this health promotion course is specifically focusing on mental health. and that's been a long-term module that we've been teaching at Christchurch. Very popular module, and very pertinent to people moving into the mental health field. So just in terms of access and qualifications, the entry requirements are the equivalent of 112 UCAS points. I expect there'll be probably more questions about this later on. For international students, there is a need to achieve the IELTS indicator level 6, just to ensure that your English skills are up to the requirements. And that is a standard requirement for all international students. So I'm going to touch briefly on some of the career opportunities. There's a further slide in a minute that is very busy that looks at a lot of these different things. Now, this is for the undergraduate courses, but this would also apply for those of you that are looking to go onto the master's degree course. So this slide actually is slightly duplicated later on. So I think what I will do is go into this in more detail towards the end of the presentation when I'm summing up the master's degree. The difference between the career opportunities at undergraduate and master's degree level invariably is just the entry level. Obviously, with a master's degree, you might expect to go into these fields, but at a slightly higher level. But the fields will remain the same. So I'll drop back to this slide and the following slide because they are repeated again within the MSc presentation that I'll be coming to shortly. One of the best ways of selling a course is to look at what our previous students have said. So there's a quote here from Kashan, who was an overseas student from Mauritius who graduated in 2023. And what he was saying was he loved the course, he enjoyed it, it helped him discover another aspect of health and how that area of prevention was hugely beneficial. He was very complimentary about us as a team, and as I said earlier on, we are student focused and have always put the students at the front of our learning, and he acknowledged that we were very helpful and we were always there to provide guidance and support. And interestingly, Kishan has recently been in touch with me for a reference to study at a master's degree level, so he's looking to continue his studies next year. Likewise, the lovely Emma was somebody that also graduated in 2023 and is currently with us again studying for her master's degree. And I've actually had the privilege. She was my personal academic tutee during her undergraduate course, and I'm now her master's dissertation supervisor. So I was actually meeting with her very recently. So she's still around Christchurch, studying, building on her learning. Now, one of the things from the inclusivity point of view is that we do attract a lot of mature students. I know Emma wouldn't begrudge me referring to her as a mature student. She was somebody that didn't really have a particular academic background, but had a lot of life experience and work experience. And as well as a lot of health issues that actually, for her, were something that she reflected on with her learning. Emma came to us just as we were going in the UK into some of the lockdowns around COVID, which really changed how we delivered our teaching. And one of the things that Emma really noted from that time is that the level of support that we gave students, even though they weren't on campus very much in her first year, she always felt like part of that area, a part of the community. But what we really did see during that COVID outbreak in that first wave, and particularly the first sort of year to 2 years, was it put public health right at the forefront of healthcare in general. So Emma's described that as a bit of a light bulb moment for her. Emma works, like I said, really hard, tirelessly throughout her 3 years as an undergraduate student, and I was lucky enough, as I said, for her to have been my personal tutee, and she just brought that a bit of experience as a mature student in, and helped bring some of the younger students along with her as well. But she was very complimentary, as you can see in her quotes there, about how much that degree meant to her. And she is currently a part-time master's student, and is working in public health in the field of mental health while continuing to study. And she's always, again, you can see from that bottom quote there, she believed the staff really had a huge impact on her individually and as a learning experience. She is, as I said, continuing both with studies at postgrad level and working in the sector as well. So always good to hear from previous students to encourage future students to see what it is that they gained from the course. So as well as the academic team, we also bring in guest speakers from practice. So we brought people in from the areas of social prescribing, something I mentioned earlier. We bring in public health practitioners, and some of those practitioners are our former graduates, people that have successfully gone on from our degree course to work in things like commissioning, working with the local authority, and working in the NHS. So they often come back to guest lecture for us. We also have a number of employers that are coming in to help with various modules. We've also used people from the justice system, and also have had service users, so members of the public that actually are engaged in health promotion programs, to come in and sort of teach the current students how they perceive the system from the service user's point of view. I mentioned right at the beginning about how we put students at the forefront of our teaching and learning, but throughout the university, we are a very inclusive university. There is a student disability service that supports people through a combination of any type of disability. So we're not just talking about physical disability, anybody that's got anything that would require a learning support plan. So things like dyslexia, any issues around that, any neurodiversity issues, we can provide with people with learning support plans to help with their learning throughout their time with us. There's also a lot of IT software and support. So a lot of people come to us not really knowing a huge amount about IT, not having access to sometimes some quite costly systems. They're provided free as part of being a student here. And being a student, again, this applies to whether you're undergraduate or postgraduate, I should say. All of these things apply for all courses. There's wellbeing support, particularly important for people, overseas students that are coming to a different country to study, often leaving friends and family behind. As an extension to that, I was mentioning a minute ago that I was Emma's personal academic tutor. So everybody is assigned a tutor, and that person stays with you to give you sort of pastoral additional support throughout the time on both the master's degree and undergraduate degree courses. And we can also assign peer mentors, so students from previous cohorts, or for the undergraduate, it might be current third years that perhaps peer mentor first year students. Again, applying to both undergraduate and postgraduate courses, there's a vibrant student life here, over 90 clubs and societies that are organised and run through the student union. Lots of programs based around art, film, live performances. Also, there's a sports centre very close to, it's about a 5-minute walk from the campus. Some fantastic new facilities there. The gym's been recently been refurbished, so it's a very good area to be physically active, as well as enjoying the benefit of arts and dance, film, and so on. So all of these things, again, are available for undergraduate and postgraduate courses, and we're always trying to develop the role here. So we know that when students are happy, when they're engaged socially, that helps them academically as well. So we always encourage all our students, postgrad and undergrad levels, to be active within student life. So just moving on to the MSc course. So for September, we're just running the single MSc in Global Public Health. So the idea with this course is it runs it's a program based on a lot of different fields of work, something that is always going to help people from an employment perspective. So we again are very aware that on graduation, as I said, with the undergrad course as well, people work in interdisciplinary areas, so working with other agencies, other teams. So we look at that interdisciplinary nature throughout the learning here. We also try to make sure that we're preparing people from a research point of view and an academic point of view that'll help them not just through their year here, but potentially through their future careers, or even if they went on to study at PhD level. So there's an area of employability embedded through this, so that we're always thinking about graduate skills and what people are likely to achieve when they finish their course. So in terms of entry requirements, and you don't have to have a specific public health undergraduate degree, but it does need to be relevant. And in addition to that, all students will need to meet the requirements of any international students coming into study through the UK. So similar to the undergraduates, you have to get the IELTS score of 6 or above, with no elements, no individual elements below 5.5. So again, that is standard. So one of the selling points here is that students can help to heal the world through their MSc Public Health degree. I'm just going to see if this link is working. Sorry, it doesn't appear to be working. There is a little short YouTube video which perhaps we can make sure people get access to after the presentation. Oh, he says there's just a big delay. I do apologise. But it doesn't seem to be getting any sound. Okay, so I'm just going to have to skip through and take you through the modules that you study through the MSc course. So there's a mixture of compulsory modules, obviously, that you have to do, and you'd also then select 2 of the optional modules in the right-hand column. So there's a big emphasis on sustainable development around health. So the UN, the United Nations, launched the Sustainable Development Goals in 2015. So we look at a module specifically around how that impacts on global health. We also look at evidence-based global public health. So this is a little bit like almost the postgraduate variation of the undergraduate course that I spoke about earlier. It's preparing you for the dissertation that comes up at the tail end of the course. Also looking at, again, how evidence is created, how research takes place, and how that links in with our learning around global public health issues. There's also a module on the essentials of global epidemiology. Again, as I mentioned earlier, about what epidemiology is, the study of disease, how they spread. We will look at prevalence rates of various conditions. We would look at the impact of conditions and how they spread, not just within a particular area, but across the globe. Obviously, we'd be using COVID as an example with that. And we also look at the concept of health promotion. Again, as I touched on in the undergraduate presentation, being able to influence people's health is hugely important. So being able to promote healthy lifestyles, that's one of the things that's studied during that module. And the idea is that we take this from a local point, thinking about the types of programs that might be as small as just a little local program within, say, the Canterbury area, but actually how that also scales up on a global level. So those are compulsory modules, and as I said, you then also look at 2 of the modules available on the optional module list. Again, there's an environment, health and sustainable development module. again, this you can sort of see from some of the key words in these module titles that some of them are quite similar to the undergraduate level, but they're studied at master's level. So if people were going through the undergraduate course onto the postgraduate course, it would just be scaffolded. It would just be increased level of learning. But the same features happen globally as they would do in the UK. So as I mentioned earlier, the environment plays a huge impact on our health. And we would look at how humans interact with the environment and how that also links to sustainable development of economies and health. We also look at global healthcare systems, so we touch somewhat on some of the policies, some of the crucial policies through organizations such as the United Nations and the World Health Organization. We also look at migration, culture, and health. So, for example, we hear a lot about refugees, how people move countries for various reasons, whether it's voluntary or sometimes forced, and how that impacts on health when they reach a host country, how their previous culture impacts how they settle into a new culture. All of these things have huge impacts on health and some of the inequalities in health. It's also a work-based learning module. This is, again, it's not a placement as such. You don't spend time out in industry, but you learn, again, how through the understanding of how the workplace impacts on our health and how work-based organizations are very pivotal in promoting good health. There is an option also to pick another module from other postgraduate courses, which is part of the university's current policy. And then, that would be 6 modules, 4 compulsories, 2 optional modules. And then the Global Health Research Project is like a triple module, or you can study it as a double module and pick an extra optional one. Most people to date have generally studied the 60 credit, the triple module one, and that is the last trimester of the study period. Again, you get to choose whatever it is you want to choose, and then you'll be guided from having a supervisor throughout that study period. And that will be picking up from the evidence-based global public health module earlier on. The assessment for that is to write the proposal for the research project, and that's a piece of work that students really get their teeth into, that they study independently with some guided supervision from a member of the academic team. This short slide just shows you where those modules sit. So there's 3 compulsory modules in the first trimester, 1 and 2 optional ones in the second trimester, and then the dissertation or the combination of the 40 credit module with a work-based learning module in the third trimester. Both the undergraduate and postgraduate courses have a student nomination for the David Steers Memorial Prize. So David Steers was one of the founding members of the public health team here, and sadly passed away some time ago, but there's a memorial prize in his honor. So that's open to whoever is, there's a postgraduate recipient each year and also an undergraduate. So it recognises what they've contributed. It's not just based on grades, it's what they've brought to the course. It's also based on how they've perhaps overcome adversity, and that's a prize that's given out at the end of each academic year. So I said earlier in the undergraduate point about the careers opportunities. This slide, you see there's a long list of jobs that are relevant to graduates of either the undergraduate or postgraduate courses. So these are examples of the sort of thing that people have graduated in careers they've taken and having worked with us previously. I won't read out every single one, but there are many agencies there. Some people are working with specific organizations such as charities, drug support agencies. Some people work in local authority areas that commission public health, and many people work within the NHS. So let me just go on to a second slide, which summarizes things in another area that looks at some of those pathways. Within the UK, public health is commissioned by local authority or the local councils. So a lot of our people, including some of those guest lecturers that come back to work with us, work within the local authority. Public health graduates also often work in areas around health protection. So some of the areas that are part of the NHS, but also through civil service. There's a lot of community development work that is done through public health. And it's a surprise, I think, for people that don't know public health, the outreach to the areas that we work in is really quite wide. So we work around housing, we work around community development, we work with the public in advising on healthy lifestyles. We do outreach work for homeless shelters. We look at drug and alcohol misuse work. There's an overlap with environmental health, even within the probation system. A lot of people work in prisons. Actually, Emma, the undergraduate student I talked about earlier, and another one of our undergraduates last year are working alongside the probation service with helping to promote healthy lifestyles within people within prisons. There's also a lot of work that's done around charities, working to support people such as people that are homeless, disadvantaged, trying to address their health inequalities. So there's a very wide range of organisations and stakeholders that we engage with. And as I said, that's both at undergraduate and postgraduate level, hence the repetition of those slides. So that brings me to the end of my presentation. So thank you very much for listening. And I'll hand back to the presenters now to take you through any questions.
Thank you very much for this very insightful presentation. We do have a couple of questions coming in. I have one actually regarding the workload for the bachelor degree and the postgraduate degree, the weekly workload.
Okay, so the undergraduate degree, starting in September, you'd be expected to be on campus 3 times a week, on 3 of the days each week. So we have around about 9 hours of direct teaching each week. However, there's also what we call directed study. So each module at undergraduate level it's the equivalent of 50 hours of direct contacts, 30 hours of which is in lectures or seminars, 20 hours of which would also be things like taking additional reading, looking at videos supporting information that we recommend each week. In addition to that, for each module, there are assessments. That will be the same for a postgraduate as well, and that takes quite a bit of independent study. We also recommend reading. We've got core reading lists for every module. So in all, there's an expectation of 200 hours per module. So there's 3 modules per semester or trimester, and that's the same for undergraduate and postgraduate. Basically, the success comes not just from sitting there in a lecture, having filled out the register and being present. It's engaging in the material, reading behind, in addition to the face-to-face teaching. But effectively, it's 3 days a week, and the same is likely to happen on the master's degree as well. Sometimes there's slight changes in the delivery depending on timetabling. But there are opportunities for both undergraduate and postgraduate level for people to work part-time within the number of hours that people are allowed to, which I believe is the maximum of 20 hours per week within overseas student visas. But you can actually have a life aside from just being a full-time student. It's not a 9-to-5 job, but there is an expectation, obviously, that regardless of which course you're on, that actually it's the studying that comes first rather than a part-time job.
Okay. And is there any mathematic requirements for the bachelor degree? So you mentioned for MSc Public Health, there is no specific academic background required.
There's not. So some courses you do have to have a GCSE equivalent. That's not the case for the undergraduate, no.
Okay. We have a question regarding which academic background is required for a student from Nepal to study public health or the Bachelor of Science in Mental Health or Well-being.
Yes, so generally, it's at undergraduate level. There's the equivalent points system now. Obviously, I'm sorry, I'm not an expert on what the Nepalese education system is, but our admissions team will know more about how individual nations' secondary education and further education links to the UCAS system, and those points equivalents that I talked about earlier, those UCAS points. Generally, being able to demonstrate a solid academic background suitable for undergraduate study is fine. It doesn't have to be in a certain area. You don't have to have specific science-based qualifications, for example, even though it's a Bachelor of Science degree. So yeah, there will be equivalent qualifications, whether it's Nepal, Pakistan, whatever. Obviously, there's so many educational systems out there. I'm not aware of each one and how that equates to the UCAS tariff points.
And just a reminder to all students, we have actually local team members, like in Nepal, that you can absolutely reach out to find out exactly the academic requirements for any country that we are in. Does any alternative English test is accepted? So Richard, would you like to reply to this one?
Yeah, of course. Thank you, Sybil. So all of the English language requirements are on our web pages, but obviously we accept IELTS, we accept Pearson, we accept TOEFL, and we accept the online the Oxford International Test as well. But for all of the different English language test levels that you have to achieve, you can refer to the website.
And just for the Oxford online English test, there is actually on the website a discount code for Canterbury Christchurch University. So Canterbury is still one of the universities that accept online courses. So please don't hesitate, use the code if you don't want to go to the IELTS or TOEFL in that manner. Does the program meet eligibility criteria for further qualifications such as the UK Faculty of Public Health exams? Maria, I think you're muted.
Sorry. I put myself on mute for a moment, so I didn't interrupt Richard, and then I forgot to take it off. So there's a public health register in the UK. It's not mandatory, so many practitioners aren't part of that registration. So it's a very good question. Some courses as part of the degree, you would automatically get registration if it's a requirement. Because there's no legal requirement to be on a public health register, you don't have to do that. However, the learning from the course is very, very useful at being able to evidence for things like portfolios that you'd have to present as part of professional qualifications. So it doesn't link directly, but you could use a lot of the same learning to gain qualification at various levels for the UK Public Health Register. That's a very good question.
Very good. Could you please share about the criteria for an English language waiver to be applicable for a candidate from India?
So I think for this one, Sybil, probably best for the student to reach out to the in-uni representative on the ground in India to find out. It would depend where the person has studied in India, because I believe there are some waivers available for certain regions, right?
Yes, there is certain boards that are actually accepted, but as Richard mentioned, please reach out to our team in India for more detail about the boards. Can we become psychiatrist or physiologist after completing a bachelor degree in mental health and well-being? If not, then what kind of actual roles we get?
Again, another very good question. So one of the things, both the public health and the mental health undergraduate courses, um, they they're not specific in the sense that when you graduate, you go straight into a particular career. So, for example, if you were doing a physiotherapy degree, the expectation is that you would be a physiotherapist at the end of the degree. There isn't a specific standalone core profession waiting for people at the end. Now, some people see that as a disadvantage, but I would very much see it as an advantage that your career is much more open. So that slide, for example, that I had many, many different areas that people can move into. Now, things like psychiatry or psychotherapy invariably require additional specific qualifications. Sometimes that's not necessarily doing another degree, or it wouldn't be another degree. Sometimes it might just be specific training within an organization, like a national governing body. Also, many people going into a specific role like that might study at a postgraduate level, and then the relevant public health or mental health undergraduate degree would be very beneficial at getting onto a more specific master's degree at the next stage if there's a very, very specific career pathway that someone, an advanced career pathway that someone wanted to get into.
And I believe Canterbury has actually in psychology a master degree that is a conversion or a general.
Yes, correct.
Degree,
yeah.
correct?
So yeah, I think on the back of that one, you can then that will get you the professional body registration, so you could actually legally practice as a psychologist.
Okay, very well. Is MSc Global Public Health program a I'm very sorry about that. A conversion program or not?
I'm not 100% sure I understand the question. It's not. It doesn't convert into anything specific. Again, as with the undergraduate, there's those wide range of careers available at the end. So yes, our master's students, looking at some of those examples that we had, can go into advanced roles within many different fields. But it doesn't convert them into there's not a specific career just as a public health practitioner. However, many people working in, for example, some of the public health commissioning fields, entering that at master's level would be a real career accelerator. You could move up through the grades much quicker with a qualification at master's level.
You mentioned earlier in the presentation that the MSc Global Public Health does not have to have a relevant background to apply for this program, correct?
No, well, relevant. So I think in my accent, it should be relevant. However,
okay.
Obviously, I was just as an example, I was talking to my new intake of master's degree students yesterday when I was teaching them, and I was just getting to know them. There's people that we got 2 vets on the course at the moment that have obviously looked at animal health, that have decided to study human and public health, which I thought was very interesting. We've also got a teacher, someone that had a biology teaching background. So generally, most undergraduate degree courses would be considered appropriate if you can. Obviously, the idea of studying at a master's level is that you feel that that's a career pathway. So you don't have to have done an undergraduate course in public health to get onto the postgrad course. But if you did, it would just, a lot of the understanding and the learning you'd be able to build on. But as I said, with the vets, the teachers, people like that we've worked with in the past, we've had lab technicians, people that haven't got, people with quite clinical backgrounds, anything like that is fine.
They kind of need to have, because I had some cases of vet, doctors, nurses as well, applying for the program. So they have to have a relevancy in the medical or health field in some way.
In some way, but I would honestly think if people were able to demonstrate a learning at undergraduate level, they've got a degree. If they're if they feel that public health is a field for them, they've got a learning at the appropriate level to then get into that degree. So yeah, the likelihood is that regardless of what undergraduate degree somebody has, if it's at the right level and they meet the requirements with the language skills and so on, that we would take them at master's level in public health.
But for example, a student that is in nursing, had done a higher national diploma and has experience, this person could be considered for a master degree?
Likelihood, yes. Yeah, they'd definitely be considered. Generally, there'd be a decision made through the administration, the academic administration team, admissions team, sorry, not administration team, that would take into account previous learning. And again, some of those elements around backgrounds and how you demonstrate the equivalent learning, even without a specific qualification, would be taken into consideration. But it may well, yes, be a nurse with experience but has HND type qualifications may well compensate from not having finished a degree, a full-time degree.
Excellent. Richard, a question about, job and how Canterbury is supporting actually part-time job, volunteer job.
Yeah, of course, Sybil, great question. As Murray pointed out earlier on in the webinar, as international students, you can work for up to 20 hours per week during term time. So you can really supplement your finances by finding a part-time job. Lots of support available at Canterbury Christchurch. Obviously, Canterbury is a very beautiful city. There's lots of tourism, both in Canterbury and in the surrounding areas. So I think it's very, very easy to find a part-time job. In addition, in 2023, Canterbury Christchurch was #1 in the UK for employability for graduates, finding jobs for graduates and supporting that. So we've got an incredible team here that help all of our students and all of our graduates to find their dream job. And I'm sure Murray would agree that employability and employability skills really are embedded across all of the courses, across all of the curricula. So lots of support available, Sybil, in terms of practical support, even, workshops on how to be a great candidate in an interview, what to wear, communication skills, CV writing workshops, all of the detail is really, really looked at here. So,
and can you tell us about the fees quickly and scholarship?
Yeah, sure. So fees are $15,500 per year for overseas students. We offer an international student scholarship of £1,500. So that reduces our yearly tuition fees to £14,000. Also remember very, very quickly that Canterbury is outside of London. So we're only 55 minutes from London on the high-speed train, but we're down in Kent, in the Garden of England. So Canterbury is a lot more affordable than, say, London, both in terms of the cost of living and our student accommodation as well. We've got a great range of student accommodation, which ranges from £128 per week up to £176 per week. So a lot more affordable than, say, a study destination like London.
So very, very good. Well, we are at the end of the questions. So if you have not applied yet, please put your application in. If it's not completed, the deadline is fast approaching. We are very excited to maybe see you in September on campus, joining the big Canterbury Christchurch family. And for any question relative to your region specifically, don't forget, we have actually our team on site that can help you with any question. Thank you again, Murray. Thank you again, Richard, for this very, very interesting webinar.